physiological basis for placebo effects came when researchers studying dental patients found that chemically blocking the release of endorphins, the brain's natural pain relievers, also blocked placebo effects. Remarkably, these effects can occur even when people are told they are receiving a placebo, as illustrated in studies of irritable bowel syndrome, or IBS. One study compared two groups of irritable bowel syndrome sufferers. One group received no treatment, while the other group was told they'd be taking an inert drug delivered in bottles labeled placebo pills. They were told placebos often have healing effects. The results surprised the researchers. Patients who knew they were taking a placebo reported twice as much symptom relief as the no-treatment group. That difference was comparable to the improvement seen in trials for the best irritable bowel syndrome drugs. Expectations influence the number and seriousness of side effects experienced by women who receive hormone therapies, such as tamoxifen as part of their treatment for breast cancer. When women have greater expectations of suffering and side effects, they experience nearly twice as many side effects, joint pain, weight gain, and hot flashes, after 2 years of hormone therapy than women with positive expectations. The women also experienced symptoms that were not directly attributable to their medication, including back pain, breathing problems, and dizziness. Women may stop taking their adjuvant hormone treatment if nocebo effects cause them to experience adverse side effects, which can affect the success of treatment. Early interventions like counseling may help women understand the effects of expectations on their experiences and thus better manage their symptoms and commit to continuing to take their medication. As strange as it might seem, nocebo effects can even lead to death, as Shelley Adler describes in her book, Sleep Paralysis. Adler, a professor in the Department of Family and Community Medicine at University of California, San Francisco, set out to explore the phenomenon of the classic nightmare across cultures and history. In REM sleep, we dream, and our minds typically shut off the physical control of our body. During a phenomenon called sleep paralysis, however, a person experiences an REM state that is out of sequence. We're supposed to be temporarily paralyzed while we experience REM sleep, but we aren't supposed to be conscious. Yet that's what happens during sleep paralysis, which is a strange mix of brain states that are normally detached in time. Nightmares straddle the mind-body divide and the possible connection with sudden, unexplained nocturnal death syndrome. As Adler writes in the introduction to her book, quote, "The nightmare, poised as it is between the supernatural and the natural worlds, and between the meaningful and the biological, is perfectly positioned to teach us about the seamless connection between our minds and our bodies," end quote. People who have experienced sleep paralysis often feel that a malevolent being is near them. This feeling is consistent across cultures, though it goes by different names. During the 1980s, over 100 healthy Hmong men with a median age of 33 years died in their sleep. Their death rate was about the same as the top 5 natural causes of death for American men in their age group. Something was killing them, but there was no obvious cause of death. None of them had been sick. They were united only by a shared culture and dislocation from Laos to the United States. Adler comes to a striking conclusion about the cause of their deaths. They died during nightmares, killed by their beliefs in the spirit world, even though the medical cause of their deaths was ascribed to an obscure genetic cardiac arrhythmia common in Southeast Asia. Conversely, the story of John Whitley, as told in a 2016 issue of AARP Bulletin, shows how the mind can positively affect health. In July 2011, Whitley was diagnosed with stage 4 pancreatic cancer that had spread to his liver, where doctors found an inoperable tumor. He was told he had less than a year to live. Determined to beat the odds, he entered a trial where some participants got an experimental drug and others got a placebo. Every afternoon, as he sat in his apartment and took the drug, he told himself, quote, "This is a miracle drug that is going to save my life," end quote. That September, his oncologist called him in shock. Scans showed that his tumor had vanished, but his miracle remission wasn't due to the experimental drug. He received the placebo, not the drug. Nearly 7 years after his diagnosis, Whitley was disease-free. Over 3,500 such case studies have been documented in the medical literature in the Spontaneous Remission Project, compiled by the Institute of Noetic Sciences. That review suggests there's no such thing as an incurable illness, which is the point author Lissa Rankin makes in her book Mind Over Medicine.